behalf of Mayo Clinic, I would very much like to welcome you to this, our now 8th Living with Cancer Symposium for patients and their loved ones. We are very honored that you've chosen to share your somewhat cloudy, somewhat rainy Saturday with us, and hopefully it'll be a great experience. I'd like to begin by asking our CEO and Vice President of Mayo Clinic, Dr. Wyatt Decker, to make some introductory welcome comments.
Thank you, Dr. Mesa. It's great to see all of you here today for our 8th annual Living with Cancer Symposium. At Mayo Clinic, we are guided by a single primary value, and that value is the needs of the patient come first. That simple statement guides everything we do at Mayo Clinic. Today, as the nation's largest integrated multi-specialty group practice of medicine, we care across the country for over 1.3 million unique patients each year. At all of our major sites, including here in Arizona, we are focused relentlessly on offering solutions and hope to patients with serious and complex conditions. We're a little bit different than many major medical centers that way. We have chosen to continue to focus on the complex and the difficult challenges in health and healthcare. And we don't aspire to be the biggest healthcare provider in the nation in all ways. We don't aspire to care for entire populations, because we feel that there's many medical systems, including here in Phoenix, that do that exceptionally well. So for us, we said, well, we've been described as a private trust for the public good, and how can Mayo do the most good as a not-for-profit focused on complex care? And that's exactly where we have focused, is on the unusual. So whether it's making a difficult diagnosis that has been a mystery for a patient and their loved ones, sometimes for years, or bringing together teams of experts around difficult challenges, including some of the most tricky or challenging cancer cases in the United States and the world. Solutions and hope. And how do we do that? Well, I would just share with you sort of 3 pieces of the Mayo Clinic formula, if you will. And I know many of you are patients and have experienced this. And I'd ask, as I share my comments, think about your own experiences and does this jibe? One is that we have teams of scientists and medical discovery teams that are innovating constantly, and they're always pushing the envelope. And we're asking ourselves, does Mayo Clinic offer the best proven technologies, note I said proven, to take care of patients with complex conditions, including cancer? And examples of that here in Arizona include the launch of a proton beam facility that is one of only a handful in the nation and the only one here in Arizona. This allows us to use protons, which are a form of matter, to go deep into the human body with minimal damage to healthy tissue and focus on just destroying a tumor. So that's proton beam. Another example of bringing forward the highest and most valuable technology is in imaging. So at Mayo Clinic is the only center in the United States that is offering something called C11 choline imaging. So we built our own cyclotron, which is a fancy sounding term to accelerate molecules, break them apart, and create molecular imaging that can be used in PET and MR scans and PET CT scans that can find tumors that are otherwise hidden. So imagine this scenario. You've had a history of prostate cancer. It was treated, but now your PSA is climbing up and you undergo standard imaging. Your PSA is going up. There's worry that your cancer has returned, but regular imaging, including MRs and CTs, don't always find the source, and ultrasounds. So this technique allows us to provide molecules that are only good for about 25 minutes, put them into the human body, image that individual with PET scans, and see tumors that no other imaging technique in the United States or the world can see. This is happening right here at Mayo Clinic in Arizona. So those are just two examples. And the third technology example, and you'll hear a little bit more about this today, is precision medicine and the use of genomics to help guide cancer therapy. And the experts that you'll be hearing from are leading the charge in bringing the power of genomics to cancer care. And right now we're in a stage where we have cutting-edge research trials that are using genomic sequencing in rare or difficult tumors or cancers to understand, because remember, cancer is often triggered by an abnormality in the genes of the cells in the tumor that have broken loose and lost their normal guidelines, internal guidelines on when to stop reproducing or invading surrounding tissue. So if you sequence the genome of the healthy individual and the genome of the tumor, you sometimes find an abnormality that can guide treatment. And that's becoming a very, very powerful tool in the cutting edge fight against cancer. And that sometimes allows us to give tailored treatments. So think about bringing those kinds of technologies. But again, for those of you who've been to Mayo Clinic, it's really not just the technologies, it's the people. And so at Mayo Clinic, we've worked hard, including here in Arizona, to assemble what we feel is the nation's top team of medical experts, and in this case, around cancer. So at Mayo Clinic in Arizona, we have 6,000 employees. We have about 600 world-class physicians. Of those 600 physicians, over 250 of them have cancer as a major part of their practice. And among our oncology division, which is led by Dr. Mesa, who you just met, each cancer expert is expected to be a world expert in a domain within cancer, so GI cancers or kidney cancers or lung cancers, so that we have a team with deep, deep expertise around specific types of cancer. And they're doing research in these domains, and they're bringing together the best practices. But the final piece, I'd say, is that many times patients come to Mayo from across the country or the world here in Arizona because of an individual expert. But none of us as medical experts could do what we do without being surrounded by a team of really outstanding individuals, from desk staff to nursing staff to nutritionists to counselors. So it's really the team. And many of us, I've been to many retirements of world-renowned physicians who say, I've had a wonderful career and I wouldn't be who I am if I hadn't been at the Mayo Clinic. Because at the Mayo Clinic, my career was supported and my ability to care for patients. So sometimes I think I've talked to patients who make the mistake of solely seeking out a world's expert. And sometimes that world's expert is at Mayo Clinic. Sometimes there's a world's expert at Johns Hopkins or Harvard. And that's understandable. That's a natural desire, and it makes sense. And that often brings patients to Mayo, but what they realize is it's not the world's expert alone that makes Mayo Clinic so unique. It's the team of caring individuals that are putting the patient first and working together, including a team of physicians across different disciplines that are willing to talk without ego about how we can best come up with a care plan for that patient. So cutting-edge technology, world-class experts, and then this team and a culture of teamwork and service and serving our patients. When you add those things up, that is really the secret sauce of the Mayo Clinic. So as you go through your day today, I encourage you to engage, ask questions, challenge us, and know that we are here to serve you. That is why the Mayo Clinic exists. I thank you and wish you a wonderful day. Thank you very much.
Well, excellent. So a very exciting and full day we have planned for you, and wanted to make a few comments just to orient you a little bit to the meeting as well as our goals here today. Now, perhaps a show of hands, how many folks have been to one of these events in the past? Fantastic. And how many is this your first time? Fantastic. Well, great. And from my end, I think that's great. We love to see new faces, but we certainly want this to be a tremendous resource for patients that have come every year. We change it every year. The talks are different. The fields are evolving. So we hope that it's a great value to each of you. Now, as Wyatt had mentioned, we really do this for you. You know, as the director of the Cancer Center here in Arizona, as well as helping to lead our cancer efforts across Mayo Clinic, we view that there are many needs as a cancer patient along their journey. And one of those needs to really fill is education, is learning. There are many things that we can discuss in the context of a visit, but there are a lot of things that really are extra, that are complementary, that sometimes it's not necessarily the physician that's the expert in some of these topics. So it really takes a village to try to meet those important needs. Now, here in Arizona, as the director of our center, it's really a tremendous honor to be able to lead really a very active team. We're organized by over 20 different disease-specific teams and have a team that we're really very proud of. As Wyatt had mentioned, the team really involves pretty much most medical specialties. As we think about the individuals it takes to really care for cancer, it certainly takes the cancer therapy specialist, the hematologist, the surgeon, the radiation oncologist, but the team is really so much deeper in that we're never just a cancer patient, we're an individual in which we both have to battle against the disease, but we also really have to care for the rest of the individual if you have other medical problems, as well as increasingly understanding that the concept of wellness, the rest of your health, how well you're sleeping, all of these things are very important in terms of your recovery process. Now we celebrate this year, you'll see that everyone has a mug. We are continuing to celebrate this, our first year of the opening of our Integrated Cancer Center. And those that haven't had a chance to visit, please stop by. They're on our Phoenix campus, adjacent to the hospital. And as we designed this, we had really challenged ourselves to try to see how can we have a facility that helps best integrate the team, but also helps best support individuals as they face their cancer journey. And these are just some internal shots. So we're all here regarding cancer. Now, cancer clearly is one of the most emotional terms in our society. There are so many things when you undoubtedly were told that you had a disease like cancer that came into mind. Experiences from loved ones that had had cancer, friends or family that had cancer, coworkers perhaps, things you've heard on the internet or saw on The View or from Oprah. So all of this kind of comes flooding in. And even amongst the faculty, we've all been touched by cancer, with either personally having had cancer or having had direct family members. It's such an important theme of disease. Now, why is cancer such a big problem? I think it's due to many different factors, not the least of which is that overall we are aging. It's a consequence of many things that have changed. If we look back in 1900 regarding why individuals passed away, we all clearly die from something. So as we look at why individuals passed away, there's a lot of things in there that we really have improved to a tremendous degree. Many infectious causes we've made a huge impact on. Pneumonia, TB, GI infections, accidents, workplace accidents. You can think of all these different things that were quite different in the 1900s. If we look at 2010, you see that by far the two biggest groups, of course, are cancer and heart disease. And we realize that sometimes these two can interact as well, and that many of the other causes certainly have shrunk to a great degree, and actually infection as a cause has probably been the one that has changed the most over that time. Now, as a society, cancer is a very important thing for us to focus on because it affects so many lives. This is a very exciting time in that there recently has been kind of a redoubling of efforts really at the federal level as well as really at the cancer center type level regarding cancers. Many of you clearly have heard that Vice President Biden's son, Beau Biden, passed away of a brain tumor. And really in honor of his loss, I, of course, never met Beau Biden, but heard that he really was a tremendous individual. Congress passed the 21st Century Cures Act, which was a significant infusion of additional funds to really add efforts for cancer research that we're really hopeful will be transformational in terms of many different national activities. So it's very, very much of an exciting time. Now, the focus today is really to try to empower you as a cancer survivor. And our definition of a cancer survivor is really anyone that has cancer and is trying to overcome it, regardless of where you are along that cancer journey. Now, what can help you to be a survivor? Clearly, knowledge. Today is about really empowering you in a variety of different ways, some disease-specific, some general, some other aspects to really try to empower you in any way that we can. 2 is really partnership with your healthcare team. Regardless of where you get care, that communication between yourself and the team is clearly key. 3, physical wellness. Being active in whatever way is appropriate for you is clearly a key part, as well as is emotional wellness. Knowledge truly is a very important weapon against a disease. You know, your distress, your understanding, your uncertainty about the future, all of these things weigh very much on your health, and we hope that this helps to alleviate distress and uncertainty. In the past, many of you have participated. We have done several surveys throughout these conferences, and we have published these in the medical literature as a study itself, and been able to demonstrate the impact of meetings like this to really improve knowledge, to help to decrease distress in certain areas, as well as showing other important benefits. Now, for the meeting, our goals are clearly to give you information both that is general, which is why we meet in these big sessions, as well as individual information that can be more tailored to you regarding your particular part of your disease. We also hope that as you're here, you'll have a chance to meet others that are facing similar struggles, whether it's as a whole or whether around your disease. Indeed, it's a journey that you're not alone, regardless of whether you have a common disease or you have a more rare disease. Your challenges can be remarkably similar. So who is here today? So we have about 750 people coming today, some of whom perhaps a little delayed with the rain and parking and things of that nature, with a distribution across many different types of diseases. Clearly the most common diseases are the most common in our audience, but as you'll see, a broad range of different diseases in different experiences. So this is our 8th annual event, and really very grateful for the opportunity to be able to continue to offer this as a service. So our focus today, we continue to try to refine the program over the years, have new topics, as well as recircle other topics that are important. Now, at a high level, cancer is changing very rapidly in terms of how we understand it and how we're approaching it in terms of treatments. And 2 major themes are, 1, the role of the immune system. As I go to national meetings for cancer specialists, whether in the US or in other countries, it's clear that therapies related to the immune system are an incredibly important new line of therapy that are very relevant in several diseases. And with that, one of our expert immunologists and breast cancer specialists, Karen Anderson, is going to help orient us to how that is evolving. She spoke a couple years ago and was commenting to me how much things have changed in 2 years. It's really quite dramatic. Next, with all of the changes going on in therapy, we have 3 faculty members coming to really give us a panel discussion regarding how treatments are changing, with one of our expert radiation oncologists, surgical oncologists, and medical oncologists to give us that balance of those changes. Next, we're going to focus on integrative medicine. We recognize that there's many aspects that go well beyond chemotherapy, radiation, surgery for helping you overcome your cancer. And we have a very active integrative medicine team that focuses on everything from nutritional supplements, through yoga, through acupuncture, through other techniques to try to aid and assist the other aspects of care, and we'll be having Heather Fields, one of the physicians from that group, go into the natural therapies for symptom management. We'll have our break, of course, so you can get connected. Then we'll move on. We have really an expert panel of folks from the Mayo Clinic, both legal, contracting, and the business side, really regarding the evolving world of insurance changes, as well as specifically addressing and then answering your questions at lunch regarding what changes might that anticipate, with the changes with the Affordable Care Act and lots of other things. There's certainly some uncertainty, without question, with all of these changes that are ongoing. So that's always a very interesting segment. Another key area that cancer is changing, one is the immune system, two is realizing how individualized each cancer patient is. And individualized regarding the genetic changes in a cancer, as well as the genetic variability that individuals themselves have. And we'll be having a panel discussion regarding that and how that really is relevant for you as an individual. Finally, in terms of recovery, we'll have one of our tremendous speakers and anchors of this meeting, Ed Cragen, give us some thoughts. We'll have our lunch. Unfortunately, lunch today will be inside. The weather usually cooperates with this meeting. Those that have been here before, we usually have a lovely picnic outside, but given to be 50 and probably drizzling, we figured inside would be best, so we'll be across the hall for lunch. After lunch, we will be having our 2 sets of breakouts. The first set, 12 different disease-specific breakouts that you've signed up for, still can certainly sign up for or attend, and there will be individuals, both maps and individuals, to help guide you to those rooms after lunch. We then have a final break, and then we have an additional set of breakouts from 3:30 to 5 with different topics, whether it's coping with cancer as a young adult, exercise to enhance recovery, healthy food strategies, so really actually what should you be cooking, how can that help in terms of your health, as well as relaxation techniques. We put these at the end of the day. We realize for some folks it can be a very full day. So clearly, at any point that you feel that, you're kind of shot for the day, certainly please feel free to go home and get rest or enjoy the entire day, whatever really works best for you. This whole meeting is really set up as a resource for you. So the ground rules, this meeting is for you. Any question is a good question. I think our faculty are happy to discuss your disease in general, but really best not to ask them to specifically comment on changes in your specific treatment or to try to give medical advice on the fly. Probably not fair to their physicians, really probably not fair to you, is that there's so many different subtleties in terms of what is the appropriate management of your care. So a lot of individuals to thank. Clearly this is a big investment of time from my colleagues. However, it's something that we all tremendously enjoy and people look forward to a great degree, with almost 50 faculty members across many disciplines and across our other Mayo Clinic sites who are here today, as well as colleagues from Arizona State University, Strong Recovery, Singleton Moms, amongst others. We have many exhibitors that are here at the break, and like to highlight them and thank them really for participating in today's meeting. The American Cancer Society and their Navigator program, our strong colleagues at the Arizona State University, the Arizona Myeloma Group, the Ovarian Cancer Coalition, the Cutaneous Lymphoma Foundation, the Cancer Support Community of Arizona, the Cancer Survival Circle of Strength Arizona, and from Mayo Clinic, our Center for Individualized Medicine, our patient library, and our clinical cancer research office. So really many to thank, and there's tireless effort really put forward by Pam Glassley and Rachel Stiggy that helped to organize events across Mayo Clinic and put in a tremendous amount of effort. So as you see them, please thank them for their efforts. Annette Aguirre and Stacy Jones that really have been a driving force behind these meetings, our faculty, and most of all, thanks to each of you, as well as your caregivers and loved ones who are here.